Hi, my name is Andrea Dubron, and I'm a student at Grand Canyon University, and today I will be discussing the ethical issues in research surrounding ethical communication. So, firstly, I will discuss the 4 principles of scientific communication. According to the researcher Donev from the article Principles and Ethics in Scientific Communication in Biomedicine, these 4 principles include clarity, accuracy, accessibility and transparency, and understandability. Clarity refers to being clear with your speech and your writing and using straightforward words to make sure it's easily understood. It is also important to make sure to define any technical or scientific words to make sure that it is not misunderstood during the research. Accuracy refers to making sure that the data and information that was provided in the research is factual and it is backed up by evidence. Accessibility and transparency refers to being open about the methods that were used, any limitations that were encountered, and the research that were utilized during the study. This helps the audience recreate the experiment and even add to the topic. Finally, understandability refers to being able to communicate the ideas concisely with all the needed details without having to overshare and explain irrelevant information to the research. Secondly, I will be discussing the role of allied health providers when it comes to ethical implications in human research. It is very important that all healthcare workers follow the 4 ethical principles in research that are beneficence, non-maleficence, autonomy, and justice. These 4 principles are able to protect human rights when it comes to scientific research. Autonomy refers to the people's right to make their own decisions about their medical care and choices. Informed consent is a big part of this because individuals have the right to decline or accept being part of any research, as well as to withdraw from the experiment at any point. Healthcare workers should always be open and honest about the experiment and not misguide them or trick them into consenting and going out against their wishes. Beneficence and non-maleficence refers to always doing good and causing no harm. In research, this translates to minimizing the risk participants may be subjected to, as well as mitigating any discrimination or harm that may come to the patient. Finally, justice refers to being fair. This could mean that the subjects are equally distributed on age, gender, sex, ethnicity, age, and many more other factors, making sure that they all get equal opportunities. Another big point that I will be talking about is about ethical issues that might arise in research. These can include confidentiality and informed consent. Informed consent is a big one. In the past, there were a lack of ethical review boards, and many participants were lied to and misguided to consenting to researchers that they did not understand. Nowadays, it is extremely important for individuals to understand what they are going into. That includes any possible risks that they might encounter, any benefits, as well as what exactly the research is about. It is also very important for them to understand that they have the right to withdraw at any point during the study. Informed consent gives individuals the right to exercise their autonomy and decide if they choose to participate voluntarily or not. On the other hand, confidentiality, which is another big one, which refers to protecting the privacy of a patient, can become a big issue when researchers choose to divulge personal information or responses that were gathered during the research because it breaks rapport and goes against anonymity and confidentiality. It is important that research not divulge any information to public reports, and if they are going to do so, they firstly have to gather consent from the participants. Every allied health professional communicates with patients. Therefore, communicating effectively with patients within their scope of practice is very important. As a nurse, it is my primary role to communicate with patients. Therefore, I would use a respectful tone with speaking with them and actively listen and speak to make sure they understand me and I understand them. I would also encourage questions, especially when doctors come around and explain procedures. When they come around, many times, many patients are left with questions and they don't want to inconvene, so they don't ask them. I would encourage those questions to make sure that they understand what they are doing and explain to them within my scope of practice. If I can. If I cannot, I can always talk to the doctor and ask them to come by and explain everything further. I would also use less technical terms to make it easier for them to understand and avoid any misunderstandings. And clarity is very important, and being honest and open about what is going to happen. Finally, the last topic I will be talking about is about demonstrating effective skills in writing in professional correspondence. Like verbal communication, formal correspondence is important to be clear and concise. This allows for the reader to understand what is being asked or talked about and avoid any misunderstanding. It is also very important to tailor the message to the person that is being sent, making sure that if you're going to use professional words and technical words, you're sending them to a colleague instead of a patient. And if you're sending it to a patient, to make sure to use simpler words and being more concise, making it easier to understand for them. Another big point is that it is also very important to ensure that you have no grammatical errors or inconsistencies with the writing, because this could lead to misunderstanding. And apart from that, it also shows professionalism in your work. This concludes my presentation on ethical issues and research surrounding communication. It is very important to always be clear and concise and using the ethical principles when communicating with patients. Thank you for watching.